come to emergency rooms seeking COVID tests or any other non-emergency care, noting, quote, a high volume of patients driving up wait times. For medical emergencies, they said, quote, we've run out of words to describe what we're undergoing. A crisis doesn't even come close, the group said, adding hospitals are literally full. Hospitalizations remain high. That statistic is at 1,467 people in the state hospitalized with COVID-19, 269 needing intensive care. It sounds like Commissioner Malcolm has begun the briefing, so let's listen in live here on NPR News.
Admitted to the hospital and 15 into the ICU. For the last 2 years, when we've been together on these calls, we've started out with a rundown of the daily case numbers like this. And while we certainly are still tracking and posting these numbers, I'd just like to start out today by mentioning and making the point that these daily case numbers are frankly becoming less and less of the full picture and perhaps less useful as we get into the most intense stages of the Omicron surge. With a lot of people using at-home rapid tests now rather than the public testing options, rapid over-the-counter tests, at-home tests are not reported to public health authorities in terms of the results of those. And with more and more of that being the testing method of preference nationally, that just means that we have less and less of a same kind of confirmation of case numbers that we've had to date. It's also a fact that the cases that are coming through our public testing locations and our information systems and our human systems are so large, the number of cases coming in each day, that at times we simply can't keep up with the volume in terms of some of the technical aspects of processing and documenting results. We're literally being flooded with these incoming lab reports, and we are seeing very, very high numbers of cases associated with those lab reports. But we may not be able to get through absolutely every lab report that comes in on a given day, and some reports do take more time than others to validate and cross-check with other parts of our system. So we've always known that there's more disease out there than our daily numbers show. And we've always known that a lot of asymptomatic folks don't even know they have it and have not been tested. Other people have symptoms and choose not to get tested. So we've always known that our laboratory confirmed case numbers that we report to you are a partial picture, but that's just becoming more and more the case for all these different reasons. We're continuing to adjust staffing to meet the volume of work to be done to process these cases. But whatever the case, Minnesotans need to know that the Omicron surge most definitely has reached Minnesota. And frankly, circulating like wildfire all around the country simultaneously and in our communities around Minnesota. Just in recent days, many of us ourselves have either gotten sick ourselves or been exposed or know of people close to us who've gotten sick in the last week or two. And we just need to expect that that is going to be the norm for more and more of us over the coming weeks. And certainly the Delta variant hasn't totally gone away. It's still circulating in Minnesota and still making people sick. But the latest data indicate that even with a fairly high level still of Delta, Omicron has taken over as the dominant form of COVID-19 in Minnesota, as it has nationwide, with various estimates in one of our monitoring systems indicating that it's now close to or perhaps even already above 90% of all of the COVID-19 cases coming in now being the Omicron variant. The good news is that Omicron appears to cause less severe illness on average, emphasize the on average, especially if you're vaccinated and boosted. That's the good news. The vaccines are doing their job to protect people from severe illness. But if you're not vaccinated, and especially if you're older or have underlying health conditions, the risk of severe illness is still significant even with Omicron. We know that we've heard a lot of people saying, it's only Omicron. Omicron is mild. It's like a cold, nothing to worry about. Again, on average for a lot of people, that is true. But as has always been the case, a subset of the population has a lot more vulnerability. And that is very true now with folks who've not been vaccinated, or even folks who've been vaccinated but have not yet been boosted while they are in the window and eligible for boosting. We've seen around the world and here in our country, in our state, that Omicron spreads much, much faster than even the highly contagious Delta variant, which was kind of a quantum leap above the transmissibility of the original strains. So what that means is that while the average case of Omicron might be less severe than the average Delta case or the average cases of the original strains, and less likely proportionately to lead to hospitalization, it's going to cause a lot more cases overall, and we will see a lot more people needing treatment at the same time. A virus that puts a smaller percentage of infected people in the hospital, but a lot larger pool on which that small percentage becomes sick, means more people in the hospital, and it's not a good thing. What that means is that our already very strained hospitals, long-term care and healthcare systems are going to be having yet another significant challenge over the next few weeks while Omicron cases surge. And having a lot of people sick at the same time is also likely to create disruptions in other services. And we're certainly talking with employers and businesses to be planning accordingly for significant percentages of the workforce to be out at any one time. We also really want the public and the customers of these businesses to recognize the strain that these workforce challenges are going to pose. As Minnesotans, we do rightfully, I think, take pride for being practical and can-do people. So I want to really make the point that we're not sitting here as helpless victims of this Omicron tsunami. We can and we should be taking action to do what we can to help reduce the spread of COVID, to protect the capacity of our healthcare system, our Main Street businesses, our schools, our private sector workforce, our public workforce, our neighbors, and our own families. We do that by using all the layers of protection that we have to reduce spread of this extremely contagious virus. You know, frankly, we don't know exactly how all this will play out in Minnesota in the next few weeks. We look to other places for signals of what these patterns might be like, but this Omicron variant's only been around for a matter of weeks and months, a short number of months globally. And as we look at what's happened in one country or another, we need to understand the differences that might create different patterns in different places. So we are watching, with concern and alarm at what is happening around the United States, and certainly we'll keep track of any patterns that might help us predict what the likely shape of the curve might be here. We do know that Minnesota comes into the Omicron wave in better shape than lots of other places to deal with the impacts of Omicron, because we've worked so hard together, all of us, to make sure that Minnesotans have the information and the tools they need to fight COVID-19 in order to limit transmission in their own homes, communities, and social groups. And we have a robust infrastructure to support control of COVID through vaccination and testing, working very closely and very hard with our healthcare systems to help support them in being able to flex to meet this extraordinary demand. State and local government, our schools, our businesses, many other institutions are working within their own sectors, but working together also, working hard to help our state navigate this challenge. And we need individual Minnesotans to step up as well. Now really is the time to get vaccinated or boosted if you haven't already gotten that vital boosting protection. Now is also the time to use those layers of protection, like staying home when you have any symptoms, getting tested as appropriate, and yes, masking, wearing high quality masks and wearing them correctly, and taking quite seriously the fact that there's a lot of COVID all around us. We can take that simple step to help mitigate our own risks or our risks of transmitting it and adding to that spread. I'd like to focus for just a moment on testing. Certainly you've all seen stories about the incredible demand for testing that we're seeing across the nation coming out of the holidays and with Omicron spreading as rapidly as it is. And as I mentioned, we do as a state come into this next wave, this Omicron wave, with one of the most robust testing systems of any state. But even that robust system is going to be challenged by this Omicron wave. That's why we've been working in the last couple of weeks to add new testing capacity. You might have seen the governor's announcement just earlier in the week, and several announcements over the week regarding new community testing sites that have been stood up in the Twin Cities Metro and East Central Minnesota, expanding rapid testing availability, getting more tests for schools. To help meet the increased testing demand in the metro area, Governor Walz directed the National Guard to open 2 new community testing sites at metro area armories. The Guard has identified locations in Anoka and Cottage Grove as new armory-based community sites. The Anoka site actually opened today. Additionally, the Health Department announced a new community testing site that's launching in North Branch next Monday, January 10th. We're also adding testing days to some of the sites in Inver Grove Heights, Stillwater. So just doing what we can to expand the capacity of our existing testing sites as well as adding some new ones. Also, with respect to rapid at-home tests to provide families with more options to help keep their kids safe, we have secured an additional 1.8 million at-home rapid tests for Minnesota on top of the initial 1 million at-home rapid tests announced in December to be distributed through the schools. I will note that initial 1 million was delivered and is in the state and available for schools to order against, and we have secured a commitment from the manufacturer of these tests to ship us additional doses over the coming months to total that 1.8 million additional at-home rapid tests for the schools program. We're also partnering with community organizations to expand availability through other channels for at-home rapid antigen tests around the state, in working with our local public health agencies, our tribal health agencies, and food banks across the state, and our network of COVID-19 community coordinators, our grantees across the state. The state's going to provide, right at the beginning here, 150,000 at-home rapid test kits. Each kit has 2 tests each. So we'll be distributing at-home tests to those partners that I just mentioned, and those distribution partners will be notifying the communities that they serve about available pickup opportunities for these rapid tests in the near future. Testing remains a really vital tool for helping lower the risk of COVID-19. So it's for people to know their status and to act accordingly. So it's very important to make it as easy as possible for everyone to access. But as we talk about often, test results truly represent one point in time. So it's important for people to also use the other layers of prevention, including vaccination and boosters, masking, staying home when sick, and more in order to prevent the spread. With respect to vaccinations, as part of our ongoing community vaccination efforts, Governor Walz announced a new community vaccination site is going to launch on January 9th, offering first and second doses to Minnesotans 5 and older, and booster doses to Minnesotans 12 and older who are in that time window. You can make an appointment at this new Inwood Oaks site for vaccination, and walk-ins are also welcome at that site. You can get more information on all of our vaccine locations at mn.gov/COVID-19/vaccine. The site at Inwood Oaks in Oakdale will be open on Sundays from 10 a.m. to 5 p.m. and Mondays and Tuesdays from 1 to 8 p.m. This location will be administering Pfizer vaccine, again for Minnesotans age 5 and up, and for boosters for ages 12 and up. And this site can administer up to 1,000 doses per day. So this new site does further increase the state's vaccination capacity and expands access to boosters to everyone who is due, including now newly eligible teenagers. On Wednesday, the CDC expanded booster eligibility to everyone 12 years of age and older. So this is a good time to remind everybody that all Minnesotans 12 and older should get a booster shot when they are due. So all Minnesotans aged 18 and older who got the Johnson & Johnson vaccine should get a booster 2 months, at least 2 months, but close to 2 months after their single dose. All Minnesotans age 18 and older who got the Moderna vaccine should get a booster shot 5 months after their second dose, or close to that time. All Minnesotans age 12 and older who got the Pfizer vaccine should get a booster shot also at least 5 months after their second dose. And again, just want to reinforce, it's not like if you get it in the 6th month, it's not a good idea. You still should get the booster shot anytime after your eligibility, but we do encourage folks to know when they're eligible for a booster shot and to try to get it as soon as they are eligible. People who are 12 through 17 years of age can only receive the Pfizer COVID vaccine as their booster dose. And for those 18 and older, the CDC has now said that the Pfizer or Moderna boosters are the preferred booster doses. Johnson & Johnson, you can get a Johnson & Johnson dose, second dose as a booster if Pfizer and Moderna are not available, but the recommendation is to use Pfizer or Moderna as boosters if they are available. And with that, I will turn it over to Chris Erzman to talk about the updated CDC guidance on isolation and quarantine periods. Chris.
Thank you, Commissioner. This past Tuesday, January 4th, CDC released some more detailed guidance for their updated recommendations to shorten isolation and quarantine periods for the general population. I think you recall they put out some preliminary information on December 27th, but they did provide more detailed guidance to us on Tuesday. The details are available on their CDC's quarantine and isolation webpage. We are supportive of the CDC guidance and have adopted it, and we encourage Minnesotans to follow it. We know that there are some questions about how to interpret and implement that guidance, and so our team is reviewing it and is in the process of updating our materials and providing more information. So our websites will be updated in the short term, but until that happens, you can get information on the CDC website. The new CDC guidance applies to the general population, including some settings like schools. However, the shorter isolation guidance does not apply to healthcare settings, correctional institutions, homeless shelters. These updated recommendations come as the Omicron variant is now rapidly spreading through the United States, causing very high case rates, as you've heard, even here in Minnesota. And these updated recommendations reflect the societal impact, that is the potential critical infrastructure and staffing shortages that we expect to see in the coming days, as well as some growing science on disease severity and for when and how long a person is maximally infectious. What's really important is that this new isolation and quarantine guidance emphasizes the continued need to wear masks to prevent COVID-19 transmission. In order to be able to take advantage of the guidance, you need to be masking in part of your isolation and quarantine. We continue to recommend layered prevention strategies. So we want to encourage Minnesotans to get vaccinated and boosted when eligible, wear masks in indoor public places, get tested when recommended, wash hands frequently, and stay home if you're sick. And as we're talking about Omicron and its rapid spread, I wanted to share my personal story in hopes that it can help illustrate both what we're seeing and what we're asking people to do. My 89-year-old dad stopped over last Friday to wish us Happy New Year, and I talked to him in the kitchen for about 15 minutes. Saturday, he called and said he didn't feel well and slept a lot of the day. And I said, Dad, you need to isolate and you need to get tested. He was able to get an at-home test, and on Monday tested positive for COVID. And he's been in isolation this whole time. But I started to have symptoms late Sunday, and by Monday I was sick when he called me with his results. My husband also has developed symptoms, and other family members who had seen my dad on Friday were also already sick by the time he tested positive. Note, we were all vaccinated and boosted, and thankfully because of the vaccine, we all have been able to manage our illness with rest and care at home, including my elderly dad. When I asked him why he stopped by if he wasn't feeling great, because he looked fine to me at the time, he said he thought he was just getting the beginning of a cold and it wasn't COVID. So just a reminder, you can't guess what you have. If you have any symptoms of feeling off, you really need to isolate. And I told him, I said, Dad, even if it was a cold, I wouldn't have wanted to get that either. The second thing is just that by the time we had some of those test results back, we had already had lots of transmission in our family. So don't wait to isolate. Isolate as soon as you have symptoms. I haven't left my house since Sunday except to take the dog out. Omicron is spreading rapidly, and unfortunately, my family is a bad example of how fast it moves. While we can't change this new variant, we can work together to do things to flatten the curve. And I think this is imperative to keep our healthcare system working. So get vaccinated and boosted. Remember, boosters are considered to provide protection within 24 hours of receipt now. Wear a mask in public settings and isolate immediately, regardless of what you think you might have. And if you can test, certainly do, but don't rely on a test result to isolate. All of those things will help us slow the spread of Omicron and flatten the curve, which is going to make it much more manageable for all of our systems, healthcare, workplaces, and schools, to deal with this new wave. And with that, I will turn it back to Mike.
Thank you, Chris. Operator, we are ready to take questions.
Thank you. If anyone would like to ask a question, you may press star 1 on your telephone keypad. Again, that will be star 1 on your telephone keypad to ask a question, and to withdraw your question, press the pound key. We have the first question comes from the line of Jeremy Olson of Star Tribune. Your line is now open. You may ask your question. Okay, Jeremy Olson.
Operator, sounds like we missed him. Maybe move on to the next.
Sure. Thank you. Next question, we have the line of Kent Erdahl from Care 11. Your line is now open. You may ask your question.
Hi, Chris. I spoke to you at the beginning of this week, and we had several school districts say that in trying to figure out what to do about the quarantine guidelines for students, they had been kind of still speaking to MDH about the fact that there was discrepancy and just playing it safe, going with the 10-day level. Has that guidance and conversation with school districts that are asking now changed, and are you encouraging school districts to also go to that 5-day? And then I have a follow-up to that.
Sure, Kent. So at the time that we talked earlier in the week, we hadn't gotten the confirmation from the Centers for Disease Control as to, what sectors would be included or not included in some of that broad guidance that they shared with us. And so that was why we had been unable to tell our partners in the K-12 area, exactly what was happening. We now have confirmation that the K-12 sector is following that very same guidance, and we have gotten that word out to them, and we're in the process of getting all the materials up on our website. But yes, for the K-12 sector, they do fall under the new CDC guidance, which allows for a sort of quarantine in certain circumstances.
And so just to be clear, MDH is then encouraging schools to follow that as well?
Correct. Yeah, we are promoting and supporting the new CDC guidance, and it is applicable to schools.
One other question I had along those lines is that St. Paul Public Schools has been talking about at least contemplating whether or not to continue doing contact tracing and quarantining for the unvaccinated kids that might be close contacts, just because of the struggle to keep kids in and the struggle to contact trace. And they said, though, they were going to consult with health officials from the county and the state before making an ultimate decision. What would the advice be from your perspective at this point if a school district were to say we're thinking about doing away with some of that right now?
Commissioner, do you want to start with that?
Well, I think I would invite you to chime in too, Chris, but I think it continues to be important that that people know when they've been exposed and can take appropriate action. So we do appreciate the volume challenges, but we really want to encourage certainly reporting of case results of illness to MDH and local public health, so that that contact tracing process can be supported as much as possible. We still do have a specialized team of epidemiologists working specifically with schools, because we appreciate the challenge, but we need to have ways of keeping eyes on the spread that is happening in schools. But Chris, please feel free to update or correct me there too.
Yeah, I think what is important is if people can be notified. So in other words, I think that up until this point, and I know it's been challenging for our partners in schools as well as in other areas, as they've really tried to continue to be attentive to case investigation and contact tracing with the high number of cases that we're seeing. But I think it's important that folks are getting information about possible exposures. So we may not be able to, with the sort of tsunami that we're seeing with Omicron, we may not be able to do the detailed level of contact tracing that we've done before, where you're identifying an individual, but it still is important to alert people that they may have been exposed, even if it's in a broader manner. I think, it's just important to get that reminder that, hey, if I develop symptoms, I need to take action. Now, we continue to say you need to stay home regardless, but sometimes it's just, I think, human nature to try and discount things. And so at least if you've gotten that reminder, you take it more seriously. So that's why it's important that we continue to have some of that kind of information getting out to people. But we absolutely know, because we are overwhelmed ourselves, that we're not able to do things that we were able to do a number of months ago when our numbers were more under control.
I think it was just more along the lines of the quarantine decision of a child that is a close contact, and if they should be quarantining for 5 days now, or if school districts are tempted to say, we can't lose that many students that many times.
Oh, we would still, we would still absolutely say to follow the guidance related to quarantine. Now, the good news is if someone is fully vaccinated and boosted, they do not have, their quarantine involves wearing a mask. So that's a definite advantage. But no, I don't think we're at the place where we would feel comfortable just saying, oh, there's a lot going on. Don't even try to keep kids out if they've been exposed.
Yeah, that's just a really important point to emphasize there, Chris. A real advantage of vaccination is being able to not be out of school or out of activities if you've had an exposure. unless you develop symptoms, which then obviously triggers a different response. But that is a real advantage of vaccination that we hope people are aware of.
All right, thank you. Moving on to the next question. We have the line of Bill Werner from Minnesota News. Your line is now open. You may ask your question.
Thank you. Commissioner, I would imagine you have seen the letter from the Minnesota Hospital Association urging Minnesotans not to go to EDs or urgent cares for COVID tests. And some of the things they are saying, I'll quote from it. They say, "We have run out of words to describe what we are undergoing. A crisis does not even come close. Hospitals are literally full." They say ICUs, emergency departments, and medical surgical units are full. Hallways are full, and surgeries are being canceled. Can you give us an idea of at what point we are compared to other surges that we've had? Are we in better or, and maybe this isn't a fair question, but maybe you can frame it for us, are we in better or worse shape? Are we in more of a crisis? Are we in the biggest crisis we've had or not quite, the crunch, I should say, in terms of hospital space?
Well, you're right, Bill. It's sort of a multi-layered question. We're in better shape in one respect or a couple respects. We have more of the population vaccinated. We have some tools to manage this. The clinicians have continued to learn and adopt kind of best practices. And we don't yet have the same as high a level of hospitalization. So we have fewer people in the hospital today with COVID than we did in the big peak in November of 2020. We're getting close, but we don't have as many people in hospital with COVID yet as we did at one point. However, the hospitals are very, very full, not just of COVID, but of other critical care needs. And just about every clinician I know and every hospital administrator I know says that the level of the acuity, how sick people are when they're in the hospital for other conditions is higher than they've ever seen. And some of the federal teams that have been here have said the same thing, that they're kind of struck by the level of acuity of people in the hospitals. So the hospitals are very full, not just of COVID. And we've talked a lot about the fact that the staff, doctors, nurses, respiratory therapists, everybody have been running flat out for 2 years now, and they're exhausted. And we have some have moved on, moved to different specialties or left altogether or gone to part-time just as a way to kind of continue to take care of their own selves. So we have less staffing than we had during the biggest peak. So it's not an issue of how many beds we have. It's an issue of how many skilled staff we have to care for people. So yes, we've got bed capacity. Staffing capacity is very hard to backfill, but the hospitals are using, temporary staffing agency contracts. We're all doing everything we can to try to address that situation. But I think that the hospitals would say, and we would agree, that with all these factors at once, this is the most hard pressed the health system has been since the beginning of this pandemic, and that's why we're concerned about these next few weeks, that it's going to add even more stress to systems that are already operating, beyond capacity. And what that means is they're just working harder and running faster and being as flexible as they can, but also, having to prioritize care and, make sure that the sickest people are getting in first and all of that. So their work, I cannot emphasize enough how hard they're working. And, as we've said, they have been there for us every day since the beginning of this pandemic, and we really need to step up and be there for them as a community too. So I think what you've heard from health system leaders about begging the public to understand the severity of the situation, know that the hospital capacity situation is real and it affects everyone's care, not just those with COVID. and now the suggestions that, don't come here if you're looking for a test. Things like that, just urging people to not come to the hospital, to the ER or the urgent care for things that they can get elsewhere. I think it's just another sign of how very, very taxed the system is.
Commissioner, if I may, just one quick follow-up. Are we on the verge of some additional, I don't know, I guess for lack of a better term, emergency measures or contingency measures that you are contemplating implementing at this point because of what, if I understood you correctly, at least overall, this is probably the biggest crunch that we've had since the pandemic began with COVID plus other kinds of illness. So contingency measures in the near future, any other kind of things like that?
Yep. Well, I think, as you know, we've been doing a lot to try to support the health system's capacity. We've worked with nursing homes to try to keep up nursing home staffing so that nursing homes can take more transfers of people who are ready to leave the hospital. We've got those federal teams here in Minnesota. We are also just looking for other ways to make sure that people can move through the hospital system. The Department of Human Services has done some really excellent work trying to work more closely with the counties to make sure that folks who could and should be being treated elsewhere can get out of the hospital and into another care setting. So yes, the answer is we every day are trying to do something more to support the situation. But in terms of, and as we talked a little bit before, the hospitals are using, different contingency, as you said, and emergency standards of care, how, changing, charting documentation and extending, the number of people that a care team needs to cover. So all of that is happening on a day-to-day basis.
Commissioner, if I could just add something too, I think, one thing that we've heard kind of, I guess, wrestling about is just the idea that, well, Omicron isn't as serious and, the hospitalizations aren't as, we won't expect to see as many hospitalizations. And so therefore, we don't have to take it as seriously. And I think that even though, the early data suggests that this particular variant is thankfully milder, the high number of cases that we're seeing mean that even if a lower proportion of people need hospitalization, because so many people are sick, that is still going to impact our healthcare settings. And then, as the commissioner just talked about, the workforce issues, the more transmission we have in our community, the higher risk for our essential workers of contracting COVID and Omicron. So I think, it's really incumbent on us to do everything we can to flatten the curve, even if our self-perception is, well, I don't think this is as bad as things that we've seen in the past. It is having a huge impact on our communities. And so we want to all participate in flattening the curve.
Thank you both. Appreciate it.
We have the next question comes from the line of Catherine Richard from NPR. Your line is now open. You may ask your question.
Yeah, sure. Just to follow on with some of that, I've been talking to hospitals the last couple of days, and they're telling me that the number of staff that are out this week is unprecedented, sort of across the board, hundreds of staffers out. And it's really forced them to shift people from places that they wouldn't, where they normally work to places where they wouldn't normally work, among many other strategies. But one thing I've heard from all of them is that faster testing for healthcare providers would really help. Is there anything specifically that you guys are considering right now that might alleviate some of the staffing crunches that the hospitals are seeing that are directly related to this post-holiday Omicron surge?
That's interesting. I've not heard that from health systems, but actually we're meeting later today, so I'll ask them about that. Like, what exactly, what kind of testing options are they using now, and when they talk about faster testing options, what
for their
ideas
for
do
their
they have?
employees, yeah, for their
Yep,
employees,
right.
so like to get them back faster, yeah.
But I guess, so is the question then that they would, if they were sick with anything, they would have them work as long as it wasn't COVID? That seems, I just want to clarify.
Sure. I mean, I think the question is more like they have symptoms of something and they're waiting to get a test back and they're waiting days to get that result back. So they're, 3 or 4 days go by, maybe they're actually negative and could be reporting back to work. So.
Okay. I mean, because one of the things that we have talked about that is a consideration, and obviously our healthcare systems are at a place where they are, as you said, in a critical staffing place, and there's guidelines that they're looking at and following, but it's not just COVID that we're concerned about, it's influenza and other things. And so just want to be clear that, as important as it is to be thinking about COVID, we don't want to be so exclusive to COVID that we forget about the other respiratory illnesses that can also be very concerning for the population and patients.
Okay. We keep hearing that if you're vaccinated and boosted against COVID-19, Omicron might be milder for you. But left out of that discussion a lot is the question of kids who are under 5 who can't get a vaccine right now. Does the same hold true for them even though they're unvaccinated, or should we be very concerned about this part of the population that simply doesn't have access to the vaccine yet? Does it look different for them?
Chris, I'll ask you to address that, but we certainly have been seeing with alarm, the number of cases among kids nationally and the pretty concerning numbers of kids being hospitalized nationally just over the last couple of weeks. But in terms of overall, are the illnesses, any different pattern with kids with Omicron? I don't know, Chris, if you have any insight to that yet.
Well, I think, we've seen over the course of the pandemic that, kids have tended to do better with illness. That's not to say that there aren't serious illnesses, hospitalizations, complications. But as the commissioner said, some very recent data that has just come out nationally looking at hospitalizations is showing some really dramatic spikes, particularly in the 0 to 4 age group. And we're seeing it in areas of the country that are a little bit ahead of us for Omicron transmission. And so I think it's something that we have to think about and take seriously. Again, another reason why I think, we don't want to be cavalier about Omicron. We want to do those things that we can do to limit transmission. And partly because, as you have pointed out, there's still a segment of our population who cannot be vaccinated yet. And we do see that hospitalizations in that group are increasing.
Thank you. Next question, we had the line of Jeremy Olson of Star Tribune. Your line is now open. You may ask a question.
Hi. Sorry about any disruption earlier when I had to jump to another line. Apologies. And my question about pediatric hospitalization trends was just asked, although I would ask if you're even seeing an uptick in that in Minnesota. You said it's being seen elsewhere. But my main question has to do with, it's related to this issue of hospitalizations. I'm hearing a lot of talk lately about people who are trying to distinguish between COVID hospitalizations that are primarily for COVID and those that are secondary, meaning people go in for other purposes and then test positive for COVID upon routine screening. Some people are trying to separate those out to say what you mentioned earlier, that, hey, it's just Omicron, it's not going to be so severe. One, I'm wondering if you have any sense of whether there is a change in Minnesota's hospitalization pattern between those that are primary and secondary COVID, and do you have the capability to report that? Some other states do. We haven't done that.
Chris, you want to take that one?
Sure. So a couple of things, Jeremy. One is that the data that we're reporting, for instance, we have a hospital dashboard and things. The data that we receive from our hospital partners comes from or is based on actually a formal federal definition of, for hospitalization. And so they're reporting to us, and we're getting that information based on what the feds have asked. So it's the adult patients are patients currently hospitalized in an adult inpatient bed who have laboratory confirmed COVID-19, included, observation beds, all those things. And then pediatrics is the same way. Patients currently hospitalized in a pediatric inpatient bed, including NICU, PICU, newborn and nursery who have laboratory confirmed COVID. So those are the definitions that the feds are using, and so our partners are reporting that way to us. Now, we do have, our team does do a deeper dive looking at COVID hospitalizations in a more complete way. And so, that is a program, it's our COVID-Net program. And so anyone who tests positive within 14 days of an admission is evaluated, and they do chart reviews. Now, they have done, about 20,000 chart reviews at this point. And so, obviously it's a subset of what we're seeing completely because we've had, 50,000 hospitalizations. But just to kind of put it in perspective, of that overall, all those hospitalizations, 20% needed or 23% overall, needed oxygen. 22% were admitted to the ICU. 11% needed mechanical ventilation. 9% died during hospitalization. So, I think to suggest that the hospitalizations that we've been reporting thus far have not been completely, it's not accurate in some way or something. Looking at the data of the hospitalizations that we've done a deeper dive into surely suggests that these are individuals who've had, a significant illness due to COVID. Now, I think it's important to keep in mind that it's really too early to say anything about Omicron and hospitalization. And the reason I say that is that it's been, we announced our first case was identified on, we identified on December 1st, and we announced it on December 2nd. So we're barely a month out. And yes, we've seen Omicron take over, but we know that hospitalizations are a lagging indicator. And so, to already be seeing the impact of Omicron on hospitalizations, it's a bit early. What we're really seeing it on is workforce at this point. So I think that's another thing to kind of keep in mind. And then, if people have questions about, well, we don't trust your hospitalization data, certainly they can skip hospitalizations and just look to deaths, and those are quite sobering.
Like I said, there have been some states that have broken out, Iowa being the closest neighbor, that break out primary versus secondary. So somehow they take that data and break it out in an extra way. Does the COVID-Net surveillance do that, or is there any benefit that you see in doing that in Minnesota as well?
Here's the challenge. In general, when we do laboratory-based surveillance, for an infectious disease and hospitalization, we use a positive lab result plus hospital admission, and that's kind of a case-defining event. And so we use that for RSV and flu and other pathogens. The challenge is that the reason for hospitalization is not necessarily consistent across hospital symptoms, and sometimes it's a free text field, sometimes it's a discharge code, all kinds of things. So it can be challenging to get that consistently, and we have tried to use the data that our partners are giving us already. They're already over the top with the work that they have, and so the additional so we've focused on what they're providing from a federal ask. So, I mean, yes, would that be something that would be interesting to tease into? Sure, but we are looking at it. We're looking at all of our hospitalizations, and as I said, we're looking at all of these factors for severity and length, median length of stay, all of that. And so we're working on that. I'm not sure what the interest in the real time is at this point, what that would change about how someone looks at the situation that we're in.
I'm sorry, this is a third question, but I had asked it earlier. Is there any uptick, like you're seeing elsewhere, in pediatric hospitalizations, or change in the pattern of pediatric hospitalizations in Minnesota right now? Or is that too soon?
Oh, I'm sorry. I started to look that up and then I was trying to answer the rest of the
sorry about that.
The rest of the question. Yeah, I mean, when we look at our pediatric hospitalizations, we are seeing our cases our hospitalizations have been going up. So, excuse me, yeah, we haven't seen necessarily that same spike that we are seeing in some other parts of the country, but our numbers are going way up, in particular in our 0 to 4 age group, just like has been seen nationally. Excuse me.
Okay, thank you very much. Get well.
Thanks.
Thank you. We have the next question comes to the line of Carla Holt of Care 11. Your line is now open. You may ask a question.
Thanks so much. And Chris, so sorry to hear about your family. Hope you're all doing well. And I just wanted to ask about this dire situation. Of course, everyone would probably feel a little discouraged to see these numbers and to know that hospitals continue to be overwhelmed. I had a conversation with the chief of the emergency department at HCMC, and he iterated what you have said as well. But in light of what the Omicron variant is doing in terms of its infectiousness, in light of the fact that so many are getting COVID at this point, is there hope on the horizon in terms of that word that we've been hearing a little bit more frequently, endemic? Is it possible that this could be the final big push to the finish? Do we see the light at the end of the tunnel? What would you say to that?
Well, Carla, this is Commissioner. I'll start and certainly invite Chris to comment on that too. I mean, that certainly would be a best case scenario, and there has been some speculation or some thought that that's a possible outcome if Omicron moves through broadly and quickly. And again, we don't know for sure that we're going to see the same rapid increase and rapid decrease. We don't know that yet with any certainty here in the U.S. But if it did, then that would potentially both confer some additional, at least short-term immunity, and make it harder for other variants to take hold in the near term. However, as you said, I think we all understand that this is not a virus that's going to be eradicated. Almost certainly that this will become endemic, and it'll just be something that we deal with. That is like other respiratory illnesses that are just always around in the background, so to speak. So that is a possibility, and certainly what we hoped for. But this virus has kept us humble and keeps keeping us humble, and so we're really quite reluctant to say, yep, this is the end. We wish we could, but have learned to be more cautious than that. But Chris, what would you say to that?
Yeah, no, I agree. When you were asking the question, I thought, oh, I wish that was exactly what was going to happen. But as the commissioner said, we have had a lot of twists and turns with this virus, and so we'll have to wait and see. I think the other thing to keep in mind too is that everything that we've experienced has come from other parts of the world, and so as we're working to ensure that our population is vaccinated, we want to make sure that the global population has access to vaccines, because the virus has the opportunity to mutate in other parts of the world. So we'll have to continue to watch what's happening not only here but globally. But I think what you described would be certainly a best case scenario.
Just to follow up, is it a case then of over optimism as we are hearing endemic being talked about more frequently, and as we think about a possible new normal where this phases into more of a flu situation where we do receive the boosters on a regular basis and kind of fight against the virus in that way? Can you just speak to why is this increasingly brought up, and is it just that we're tired and we're looking for that silver lining, or is there actual science behind it?
I think it's perhaps a bit of both. Yeah, certainly it's a credible, plausible theory of how the disease might progress. But again, as Chris has said, it's awfully early to be really banking on it. But go ahead, Chris.
Well, I was just going to say that, the definition of endemic really, means that it's disease that's it's always in the background. It's always there. And you kind of acknowledge that you're just going to have it. It's not a pandemic anymore. It's not an outbreak anymore because it's become what's expected. And so I think what people are suggesting when they talk about moving to the endemic phase of SARS-CoV-2 or COVID is that, we've moved to a place, or we will move to a place where this pathogen doesn't disappear, but rather we manage it and, we work with it, and it's as you said, it's kind of there, and we get boosters, and it's in the background like influenza. I think that we need to start thinking in that direction, but I think that when we're, for instance, in a situation like we are now with Omicron, with the very, very high numbers of cases that we're experiencing, I think we have to be a little bit cautious of thinking endemic. If for some people endemic means ho-hum, it's just the norm, it doesn't matter, I'm just going to live my life. I think even when we talk about a disease like pertussis or influenza that's part of the landscape, we still take it seriously. We still recommend vaccination. We still tell people that they should stay home when they're sick. And so I think even as we start moving in our minds to thinking about how will we manage with COVID or SARS-CoV-2 in the long term, I think it's really important that move isn't a move toward complacency, like it doesn't matter. I think it's a different way of living our lives, but it's not a complacent one.
That is all the time we have for today's call. We invite any reporters with additional questions to reach out to our office this afternoon. Have a good day, and we'll...
All right, and that is today's briefing from the Minnesota Department of Health. The headline from that briefing from Commissioner Jan Malcolm: Omicron is circulating like wildfire. Malcolm saying daily case counts are becoming less relevant because many people are using unreported rapid tests. Stay with us. All Things Considered next here on NPR News. This is 91.1 KNOW, Minneapolis, St. Paul. We are member support.